Hey guys, Dr. Jeff Feenstra here with Chiropractic, and I just wanted to shoot a quick video to demonstrate one of the supportive taping techniques that we do for wrist problems. Primarily going to talk about carpal tunnel syndrome today, this is just an adjunct that we do to help with carpal tunnel. Carpal tunnel, a lot of times the treatment is going to be multimodal. We're going to do some adjusting to neck, thoracic spine, shoulder, elbow, wrist, kind of down that entire chain of movement. And then also some soft tissue work kind of in and around the carpal tunnel itself. And so we want to make sure we release everything through the carpal tunnel, all of the flexor groups, the extensor group. There's going to be some rehab exercises and things like that we're going to do as well. But I just wanted to demonstrate one of the taping strategies that we use. A lot of times doctor's prescription will include some bracing. Bracing is really uncomfortable and it's just not something that's fun to wear all day. And so I'll show you one of the taping things that we use that helps. And so the tape that I like to use for this is actually dynamic tape. Kinesio tape can work well, is a good tape as well. But I like dynamic tape just because it's a much stronger tape, and it actually has the ability to kind of offload that joint and to create a little bit more space in that carpal tunnel for the nerves and vessels and things like that to go through. So let me show you real quick how I apply this taping strategy. So what I'm going to have Gina do is we're actually going to bring her wrist up just a little bit, and then tear ourselves a good long anchor. I usually like to use about 3 to 4 inches of an anchor, and then we're going to apply that. Actually, Gina, just bring your hand down for a second. I'll apply that anchor. Apply that anchor down. Big thing on this dynamic tape, because there's a lot of tension, is you don't want to have any stretch on that anchor, and you want to use a big long anchor. That way there's no blistering or pulling of the skin. Now we're going to shorten the joint. So as we shorten the joint, what we do, the bracing actually, the splint that they use is called a cock-up splint, so it actually holds the wrist like that and kind of puts the wrist in a rested position. This tape is actually going to kind of create that for us without the bulky brace. So we're going to bring Gina's wrist up. We're just going to pop that tag end off the tape. And then we're going to go all the way up. This tape you don't usually have to stretch too much. Put just a tiny little bit of stretch into it. We're going to cross her elbow a little bit, which is okay. And then you see how, I've kind of put a little tension in the tape and it's kind of bridged up just a little bit. So now all I'm going to do is I'm going to stretch her just to kind of take that skin. You can kind of see that skin fold that happens under there. We're just going to take that out just a little bit. The tape stretches, and then we're going to lay it down. Make sure we activate the adhesive really good. And now, if Gina just holds her hand out and just kind of let it rest, just kind of let that rest. Don't put any. Now stick this one out and just let it rest and hang. Let this one rest and hang. There you go. So the idea behind it is that we're kind of creating to where the tape just holds her hand up just a little bit. And that just kind of takes the edge off and just kind of, like I said, creates some good space in that carpal tunnel. Last thing I'm going to do, we're going to turn her over, you can relax that one, is I'm going to use another piece and I'm just going to kind of almost try to separate those carpal bones a little bit. So I'm going to tear the tape right in the middle, just like a Band-Aid. Open up the sides. And then I'm going to catch her wrist. I'm going to turn that way just so we can see a little better. I'm going to put a little stretch in here and just kind of open it up a little bit. And we're going to turn back over, and then we'll just lay it down. Now, just like Kinesio tape, dynamic tape is a really durable tape. Usually we can get 3 to 5 days out of this tape job, so it's really nice because you can wear it for about a week, kind of in between treatments. It's highly waterproof. Water doesn't really affect it, and I like it too. Because of the type of material, this tape is actually recycled rubber and lycra, and so the edges don't really fray that much. And so it's a really durable tape, really good option, especially that way you don't have to wear the bulky brace. So if you have any other questions, there's all kinds of other good info on our YouTube channel here. Check us out on Facebook, go to our website, and yeah, thanks for watching. Dr. Jeff with Pro Chiro.